Councilman Conwell asked if we would come back and do an update in a few months for the work of our division, and we sort of seized this opportunity on your schedule to be able to give you an update on the Health Equity and Social Justice Division at Cleveland Department of Public Health.
I'm out of yours. I thought I turned this off. Start. Finish that start.
You will have these slides available to you. They've been sent over, as well as a one-pager specifically on the interdepartmental equity team that we've been working on. The first slide is just some context that you already know, so I'll just kind of breeze through it. As you know, this division stems from the city's declaration of racism as a public health crisis in June of 2020. Council passed the ordinance in March of 2021 to create the division itself. The mission of our division is to improve the health outcomes and the overall quality of life, and to remove barriers to resources in order to create thriving neighborhoods in a thriving city. Really, the work that we're doing is to elevate equity across all of the work that we do within the health department, as well as with our community partners and across city departments. We work, the work that we've been integrating takes on equity work that was already underway in many ways at the City of Cleveland, as well as integrating some of Mayor Bibb's administration's recommendations that started off in his transition report. There's an equity section there as well. We work really closely here with Tyson Mitchell, the Director of Office of Equal Opportunity. And we still are doing a lot of work with the Racism as a Public Health Crisis Coalition. That is an external response to the initial declaration. Our staffing of the division, as you probably know, we took, once this division was created, we took some programs that were already in existence at CDPH and moved them into this division to give them a little bit more support and to really start to work at the health equity issues at play there. So that is that's the bulk of where our staffing is, but we also do have some divisional positions that myself and 3 others assist in carrying out the work that we do with RAFC and the work that we're doing across city departments that's focused specifically on health equity and social justice. So in our table, we have 14 FTEs, 8.75 our general fund, and then 5.25 are grant funded. Early 2023, we were able to get the HESJ divisional folks on board, and so that is our project coordinator, Lydia Hill, who's with us today, as well as our policy analyst, policy research analyst, Sarah Tilley, is also here. Both started early 2023. We also have a assistant administrator in that role, in that divisional staff layer. We are actually, we had that position filled for about 6-7 months, and we have a vacancy right now that we just put in a hiring recommendation last week to replace them. We have 1 long-term retirement coming up in November. In our programs, we have 4 vacancies. 2 like I mentioned, 2 hiring recommendations were submitted last week, and they're in process, and we have 2 positions that are, the retirement position is in process of being posted, and then we have 1 other vacancy in Moms First that we are getting reposted to be able to fill that position again. So there's the layout of the staff there. Again, it's a mix of division staff and mostly program folks. This is, you'll have this again. This is I know it's tough to see. At least it's tough for me to see.
We have it here too.
Okay, oh, perfect. So this is where it makes up, and you can see the 4 programs that are in our division. OMAR is the former Office of Mental Health and Substance Abuse. It's now the Office of Mental Health and Addiction Recovery. Some better language around that. So we have a project coordinator, 2 new counselors. That's new since last time I saw you. We were gearing up to be able to get our counselors on board, and those positions were posted. They've now been filled. We're now looking to hire 2 peer support counselors underneath those 2 counselors as well, to kind of round out the services that we're getting ready to start back up. We also have our HIV STI project coordinator in place. There's one vacancy there that just became vacant in the last couple of weeks, and we submitted to have it posted yesterday. A relatively long-term employee was there as the grant administrator. So that one is a vacancy that will be filled here soon. New also, we brought over at the end of this, really end of this quarter, right around end of August, and still in a little bit transition. We did a year-long transition to bringing the Office of Minority Health into HESJ for a couple of reasons, mainly that, as you all know, my colleague Frances Mills, Commissioner of Health, previously had served as the Director of the Office of Minority Health, and once she transitioned into the Health Commissioner role, took some time transitioning that program and project. We finally brought on a new director, which is Rafiq Ali, and we wanted to give him some time with her to be able to transition all of those years of knowledge and, all of the ins and outs of working with the Minority Health Commission in Columbus to him. And so she and I worked very closely together anyway, but we did not bring that program underneath the umbrella of HESJ because we wanted it to stay in her purview while she could, do a nice transition with him. So he joined our division officially at the end of August. That's Rafiq Ali at Office of Minority Health. And as you know, also Moms First, which is our response for infant health and maternal health. We do have 2 vacancies there. One, hiring a rec for the deputy project director just went in last week, so we're expecting that person to transition over here shortly. And then the last 3 are the divisional staff, which is Lydia Hill, Sarah Tilley, and we do have 1 vacancy for the assistant administrator. So the 3 major buckets of work that we've talked about within the community, of course, we are aligned with the Racism as a Public Health Crisis Coalition. I sit on their executive committee and help with some of that planning as well. Commissioner Mills also sits on that committee. Within the city of Cleveland, within the health department, as I mentioned, those are the 4 programs that we look at to prioritize health inequities. If you look at HIV/AIDS, Moms First, Office of Mental Health and Addiction Recovery, Office of Minority Health, that's really where we're talking about health disparities, especially for Black and brown communities here in the city of Cleveland. The other piece of the work is within the city of Cleveland. That's that interdepartmental equity team that Tyson Dixon and I started and kicked off last November, where we had each department, so chiefs and directors chose someone in their department to come on board, where we are utilizing social determinants of health to organize our equity work and taking that away from just being the responsibility of the health department and moving that across city departments to really understand how we all have a part to play in increasing or decreasing health disparities and increasing equity across city of Cleveland for our residents. And so that team, the IET as we call it for short, came together first in November of last year. We did a lot of learning around getting shared language, understanding what we even mean when we talk about equity, when we talk about health equity or racial equity or disparities. So getting all of that knowledge together. And then we did a lot of work, you'll see here in a minute, around connecting the work that we do every day back to social determinants of health and understanding how across City of Cleveland, our policies, practices, our services that we provide, how we impact the health outcomes of Cleveland, thereby how we impact equity in Cleveland. So we are at the point now where we are drafting our first strategic plan for that group. And we are looking to now get into the phase where we're doing health and equity assessments on our procedures, on our services moving forward. We are also, you'll hear it toward the end a little bit, that we have also began the process of instituting an equity advisory board here at City of Cleveland. And that with that, we're examining the diversity, equity, inclusion structure.
Go back a little bit.
Sorry,
You
yes.
said Equity Advisory Board?
Committee,
Where?
yeah, or board, yeah. So if you take a look at what we did, was we did an equity inventory. So across City of Cleveland, what we have in place already, who's working in the space of some type of equity, if it's racial equity, health equity, are we looking at programs that exist here in City of Cleveland that have something to do with social justice, or are they working with specific populations? Easy examples are looking at, in Community Relations Board, we do have a Hispanic liaison, we have an Asian liaison. In 2 other departments, we have LGBTQ liaisons. Like, so looking at folks that, one, what is that work that's been going on in different pockets, in different departments, having some correlation or connection to equity, or working with a specific population. Like, we do have some programs that are working specifically with youth. So looking at our Department of Aging, through this process of beginning to create this Equity Advisory Board, I learned something that I did not know, that our Aging Department also serves a large part of residents and communities that are dealing with disabilities. And so, we have a lot of special populations that we're serving and working with. So bringing all of those folks together, we created an inventory to see what was already here, and then looked at what was in those recommendations in Mayor Bibb's transition plan around equity, like, the things that were said at the beginning of his term. You need to have this in place, you need to, focus on this. Looking at the things that were created after he came in office, and putting those all together. And so where we are now is Tyson Mitchell, Director Mitchell and I are bringing together all of the folks that work anywhere in Cleveland in that type of space, and working with a specific population or representing a specific population, coming together to kind of brainstorm. Every single person that I've talked to so far that is interested in being part of this, sort of broader DE&I work, separate from the interdepartmental equity team, is really, one, excited, because a lot of times, if we're working in our specific departments, it gets kind of siloed and you don't connect with other people who are doing similar work. So it's a chance to connect, and it's every single one of them has come to the conversation with recommendations, things that they wish we were doing or they would like to do, or just recommendations that, if we did these few things, it would advance equity in City of Cleveland astronomically in a short term. And so we're coming together to one, meet everybody and create that network, and then also to really look at what are some things, recommendations that we could make that we could get off the ground in the first, that would take 3 to 6 months and very little resources, and what are some things that might take 6 months to a year and beyond, right? And begin to give those recommendations over to Mayor Bibb so that we are having a more formalized approach to diversity, equity, inclusion here at City of Cleveland. And it's twofold. It's about what we provide to residents in an equitable way, but it's also about what we do for our employees and for the City of Cleveland as an organization. Is that helpful? Okay.
Yes.
Okay. Just another quick look at social determinants of health. Again, this is how we're organized, both on RAFC, the Racism as a Public Health Crisis Coalition, and our internal work at the Health Department within our division of HESJ, and our interdepartmental equity team has really stood up around these 5 pillars of social determinants of health. So making sure that we're taking a look at education, access, and quality, making sure that we're looking at healthcare and quality. This is a CDC concept, by the way, neighborhood and built environment. I'm sure you can all connect the dots back to any number of these to actual health outcomes for people in the City of Cleveland. Social and community context, and economic stability. So those are our 5 pillar working groups and our working areas. This is another CDC model that just kind of talks about how we balance infrastructure to get to health equity. And it's kind of just a helpful illustration of understanding that it's a combination of how you run programs, how you provide measurements, and then how you influence and work with and advocate for policy. And so for us, it's difficult when we talk about equity sometimes, because we're all very programmed to think about programs, and equity is not a program. It's about how you do your processes, right? It's very fundamental to how you are, how you behave, how you conduct business. So we're trying to move people from the concept of thinking this is the equity program, right? It's not really a program. This is more about injecting equity into the things that we do, which might be programs, it might be services, but it's also how we conduct business, right?
You know, your processes fall inside the program. You have your program here, then you have your goals and objectives. But your processes, if you're going to measure anything, you measure the processes because the processes can change on you at any given moment. So you do a process analysis, but you can't do a process analysis unless you're inside a program or some kind of object, because it has to have a framework to do a process, because
Right.
you can't just do a process to do a process.
Well, there are processes that are independent of a program, right? So like, just say coming to work every day in your division, how the staff works together, how the programs work together. There are things that you measure about the processes that you do that are not necessarily always a program, right? Of course, every program has processes, right? But there are some processes that we do. This is just, opening the door and turning on the lights every day is a process. That's more what I'm
Yeah,
saying.
but that's a weak process. When I think about a process, is inside of a program or a process when you come to work. I mean, is that process will fall inside of work, because work is very important. You got to be able to measure work because you do evaluation processes on work.
Of course.
So you know that you're hitting your workload and your goals and objectives, so you can have better outcomes.
Right. I would say to that, I think we might be getting a little into semantics here, but that's everything has a process, but not everything has a program. Just like
Everything doesn't have a program.
Right. In
Right.
HR, we have hiring processes. We don't necessarily have a hiring program, right?
Well, we get to but
I'm
you got to
just-
be in HR. That's one of the most important departments in any business or city, and you have to be able to measure that because HR is very, very important.
You can
There's a
measure
lot of things
process.
going on. Right, but we'll talk We'll talk
All right.
offline.
Okay.
I like that kind of stuff.
All
We'll talk
right.
offline on it.
I'll
All
see you
right.
after this.
Okay.
Okay. This is just a little bit of background and update on Moms First, which you're already very familiar with. It's a free program that supports new and expecting mothers. Participants are paired with community health workers from anytime in their pregnancy up to the babies are 18 months old. Over this past year, we just recently launched contracted with a new agency that's providing services with us. We just finished our contracting with Westside Community House. They will be working on the component of the program that goes across the city because they work mostly with CMSD on adolescent program participants. And they also handle our special populations. We do have a project that's in conjunction with Metro and Birthing Beautiful Communities that services women who are currently in the county jail system, if they're pregnant, in jail, and making sure that they have access to these same services while they are incarcerated. The special populations program also services moms who may be finding themselves in alternative residential situations like our shelters or rehab facilities. And there's some,
Commissioner,
yes,
Councilman Harris.
Through the chair, these are the 6 month stats,
6 months.
2023.
This is a year, correct?
They are through the end of last month.
So for 2023, this is through the end of last month.
Great, thank you.
Yeah.
Yeah, that's good. And always put the fathers in there. I always put the fathers.
Of course. Yeah, we do have a very strong fatherhood component of Moms First. And that just gives you a little bit of update from the last couple of years to where we are current in this year. Also, a little bit of our HIV metrics. As you know, the program pretty much handles the housing opportunities for persons with AIDS from HUD. That's federal dollars that help with housing. We've been providing those services through our contracted agencies for literally decades now. Also do some prevention programming support that also come from our community development department here at City of Cleveland by way of CDBG. dollars. Little bit of an update. This past winter, Cleveland and Cuyahoga County signed on to become a fast-track city, and what that means is just reorganizing your HIV work to really join with other cities in the country and across the world to make sure that we're fast and quickly moving to 0 new HIV infections in a year. Yes. Yeah, so we're partnering, of course, with Cuyahoga County on that. And there's some of our numbers. We did see I think all of our programs are seeing some fluctuation. The most drastic number of fluctuations that you might see is kind of us getting back right from COVID. That larger number there in 2021 of HOPWA clients receiving nutrition, transportation, and other assistance is because we did receive extra funds coming out in COVID and during COVID to make sure that we were helping with more food assistance, more transportation assistance for safety, really. And because so many people were losing employment at that time. Again, a little bit more on our internal programs, which, I'll go through a little, but feel free to ask questions or you'll have this information. So OMAR, that's the Office of Mental Health and Addiction Recovery. We hired our brand new coordinator in May of 2022, and we had been down the coordinator almost through COVID, almost through all of COVID. We were down counselors, and I think across the board, substance use disorder treatment programs were experiencing some of the same shortages that you might have seen in nurses as well. Last summer, the new coordinator was able to help us get through the 3-year certification from the state process. So we are certified as of last August for the next 3 years to be able to provide counseling support for those in addiction recovery. We were awarded Ohio Action to Overdose funds with Cuyahoga County Board of Health. They have had this project funded through CDC for a number of years, and this is the first time that Cleveland Department of Public Health was able to join in with them. And we also have been awarded opioid settlement dollars. So some of our new programming that's going to be coming is based around opioid settlement, looking at increased layperson naloxone, looking at really doing a lot of work to build the infrastructure around making sure that people can get assessments. There's a huge backlog of people who need an assessment to get into treatment. That can be a sticking point, and making sure that we're working with our partners. The other thing with OMAR is that we typically are set up to make sure that we are providing services for folks who get mandated into drug treatment through drug court here at City of Cleveland, and we also do a little bit of work with the probation offices here, but it's also open to others as an option, located at J. Glenn Smith. And we just hired in our onboarding 2 new counselors. One has been on for about a month, and the other one just started Monday. So we feel really solid and ready to get back to regular services there. Office of Minority Health, as I mentioned earlier, we hired our new program director who has been conducting, along with Commissioner Mills, community conversations and running some billboard campaigns that are also looking at addiction recovery in specific communities and neighborhoods. These 2 examples that you see here were ones that went up in primarily Latino communities here in Cleveland. And the Office of Minority Health also contributed greatly to CDPH's COVID-19 vaccine rollout in terms of being able to partner with and work with the community to make sure that we were getting into neighborhoods that were not having as high of a vaccine intake.
You ever visit the neighborhoods? You ever walk the neighborhoods? Mm-hmm. You get up close view with a sensitive ear of what's going on in the neighborhoods?
Mm-hmm. I am born and raised in Cleveland, and I've been all over the city for my entire life, and I understand how important it is to get out in the community, visiting not only our community partners, but just being in the neighborhoods. I utilize the neighborhoods personally myself for visiting friends and family and all of that, but also the the organizations that we work with, I think the health department is very privileged to be able to do a lot of work with people who are boots on the ground. Whether we're doing focus groups, whether we're doing partnerships to make sure that we're connecting people to services. I don't think we get anything done at the health department without getting with residents and being in the city.
Yeah,
Oh, for sure.
I walked your director for 2.5 hours through my neighborhood.
You
2.5 hours. You gotta walk the
Yeah.
neighborhood, you talk with people dealing with abject poverty, you get a chance to get up close view, you see, like when you and I walked, when you were an activist, man, we walked the neighborhood, you were a little kid, I was an older guy, but you gotta walk that neighborhood and talk with the residents, you see the abject poverty that's there.
Oh, yeah, absolutely, absolutely. And I think, that's why we do the work we do, first and foremost. So I already mentioned the interdepartmental equity team, which we're about to finish our strategic plan, which will be available, and we are ready to get to the point where we are now going to be able to choose the health and equity assessment tool and then conduct those health and equity assessments on existing projects and programs here in City of Cleveland, and then also making sure that we are offering that for any new initiatives that are coming, so that we're doing a health and equity assessment on new initiatives to understand where there may be gaps that could have a poor equity impact before we even get started with something. That's the direction that we're going in. That's just the timeline that we were on. November 2022 is when we first started with the IET with the selected members. We had that series of educational workshops and working days through March and May, and connecting our work to social determinants of health and doing a lot of sort of process mapping. Over the summer, we were broken out into smaller work groups around each of those social determinants of health to really think about how are we impacting residents at City of Cleveland with the processes and procedures that we currently do, and where does that lead us to looking at our social determinants of health. We utilize results-based accountability to kind of narrow down what is our overall result that we want to see and what are the indicators that we use to measure that moving forward, to understand, are we getting closer to the good result we want to see, or are we moving farther away from it, and to be able to measure that data year over year. And of course now, last week before, we pulled that whole big group back together from working in their small groups to look at the small group work and to give feedback to one another, and that work that we did and that feedback is what is going to become our strategic plan that should be done in October.
That'd be good. You say October, this month, October.
Yeah.
I'm bringing back when the director come to us and.
If it's ready, we might have a draft. We might have some draft work you can look at. That's because we're coming back here the 23rd, right? Yeah, so we're using October to bring that together, but it'll be available for sure as soon as it's done.
Yeah, that's cool beans, man. Thank you.
And this, also when we broke, we had the large group exercises with the folks that were chosen in their divisions and departments. When we broke into small groups, we had those people who had been selected turn back to their division and department and tag someone else to come in. So we grew a little bit with some more participation. And this isn't every single division or department, because some other people have jumped on board since we started, but these are the divisions and departments that are represented on that team. And I would say actively we have probably 16 to 18 folks, depending on, had a little bit of movement in and out. And this is just an example of the process mapping that we did. Economic stability, of course, is one of the social determinant of health areas. Neighborhood and built environment is a social determinant of health area. These are not exhaustive lists, but this is part of our brainstorming process when we came together to think about what things that we do in City of Cleveland, the work that we do every day, touch or impact a social determinant of health. And so this was part of our process to help us think about, as a large group, what are we doing every day that touches neighborhood and built environment, who's got something that is working with economic stability. And from that, we were able to derive the things that we want to be able to look at and measure that are already in existence. So that's just an example. And then on the right hand, that is building the strategic plan, using that results-based accountability. And just as an example, looking at the safety and community supports, that is one of the social determinants of health. And so that you can see what the group came up with as our overall results that we'd like to see. And then if we're looking at that as a result, and again, results are something that are, and if you're doing an RBA process, results are to be, I don't want to use the word lofty, but they're certainly aspirational, right? And so when you see something like all Cleveland, will experience this. We're saying all on purpose because that's the overall goal we're trying to work to. The indicators down below that in the yellow boxes are what we're looking at to measure. Are we moving the needle closer to that overall result, that more aspirational goal? Or are we moving further away from it? And then behind the indicators are the strategies that are employed. And a lot of the things that we'll do with a health and equity assessment is on our strategies. Are our strategies, do we have equity gaps in our strategies, or are our strategies strong in helping us to push closer to that overall goal? And so that's what this group would like to do moving forward with the coming year, is looking at our strategies that are in place, some of the programs that we're already doing, some of the processes that we're already doing, and really starting to assess them to see what are the things that we're doing that promote equity and what are the things that we're doing that might not be having a great effect on equity, and how do we fix those gaps. This is just a little bit on the RAFC coalition. Both internal, our interdepartmental equity team, and the RAFC are using the same framework, using results-based accountability, or RBA, to create plans using social determinants of health as our pillar groups, how we organize the equity work. And so if you're looking at a crosswalk between the two, and the RAFC plan should be actually coming online around the same time as our strategic plan for interdepartmental equity team, I believe same day. Later this month, there's a larger convening of the RAFC, bringing folks back together to look at those turn the curve plans for each social determinant of health pillar area, to understand what the external community process determined is their overarching lofty result that they want to see, and what are they looking at, or what are the indicators that tell us if we're getting there. Our items that are internal, our internal department equity team is slightly different because we're looking at internal to City of Cleveland's response. There's that external, more community-focused macro level, and we're connecting to that and aligning with that, but it's not going to be the same exact results or same exact goals, because we're, again, looking at how do we improve City of Cleveland internal. At the same time. And then this is the two things that I mentioned. I believe that interdepartmental equity handout right there, you may have gotten a paper copy that we sent over. That is a front and back that just delves a little further into that process around interdepartmental equity team. And then the draft version on the left-hand side is the City of Cleveland equity inventory that I mentioned, as we're beginning to start that equity advisory board across City of Cleveland. And so again, we just took a look at, in red, how you read the document, in red are the things that were instituted or put in place as a result of Mayor Bibb's transition plan in 2022. The blue are things that existed here at City of Cleveland already. And again, that's still in a little bit of a draft form, because we've been through this process of interviewing folks who are doing some form of equity work across City of Cleveland, and folks who want to be involved in DE&I work across City of Cleveland. We keep adding a few more every day, so to speak. So, but that's just an idea, so you can see the process that we're using. And when we bring this group together, I suspect this is going to change even more as we start to really delve into the work that they're doing and the populations that they're working with and serving, and the populations that they're representing. And that's that. I'm happy to take questions.
So, he's good. Commissioner, who put this together? I like this, equity inventory, well, I can get a copy of this. I
Yeah,
like this.
yeah, we can share that with you. That is courtesy of our Canva guru, Sarah Tilley, our policy analyst. We talked about a couple different ways we were thinking about illustrating this, and this seemed to be the best way to kind of lay out what that really looks like for us to, kind of see a bigger picture of what do we already have, what's coming, and what areas does that touch? Are we talking about diversity? Are we talking about racial equity? Are we talking about health equity? And to begin to bring all that together underneath one sort of formal umbrella to really elevate the work. And hopefully, if we have, we're able to strengthen it and undergird it a little bit, like looking at some of the programs that are like our liaisons that are kind of like one-person shops and begin to connect them together as a network for some strength. We'd really like to elevate that work and maybe replicate it in other ways.
So how are you measuring your, you mentioned success, which is important. So you say you want to get to a certain number at a certain time. And so how do you know that you're getting to that number or you're getting to where you need to be at? And how do you measure, are you doing pre-testing, post-testing, saying this is where we're at now, but by April we need to be here?
Yeah.
And also, you're narrating things that I see, but also in your strategic plan, and to the director also, Margolius, you can come to the table, put some background history in there. Because you jumping off saying that I see, when I see your strategic plan, this is where we need to go. But if you don't have the background history saying, this is how things started, it's hard to take that route to move forward. You see what I'm saying?
Mm-hmm. Yes, you're suggesting that, just so that I'm clear, Councilman, you're suggesting that we make sure within the strategic plan that we put background information to talk about some of the history of things that have happened. Of course, and
Right.
I can't say that I haven't done that because the strategic plan isn't done yet. So
Right.
we, of course,
I'm
will.
thinking about it
And
now,
that
yeah.
was, I think, a separate example, but looking at the equity inventory, why we have the things in red and blue there is we wanted to do an inventory overall. If you just took a look at the mayor's transition report, there were equity recommendations there, of course, and some very solid recommendations that we would like to implement and undertake and things that were going. Why we chose to do an inventory first is to make sure we do not forget or bypass that work that's been happening in these areas all along or for a number of years, by just focusing on the new, right?
Right. Because it's just like dealing with lead. We know that in the Glenville, let's say Glenville community, dry cleaners, when you raise dry cleaners, the site is contaminated. Children, people pass by, dirt kicks up, going to and from school. Background history was dry cleaners was there.
Yeah.
Other background history, we had gas stations. The gas station was raised, background history of why lead, the area is contaminated, background history lead. We know that from painting and whatever the case may be, the why. The why is is very important. And then we hit from the background history the direction we need to go. You think?
Absolutely, absolutely. And within our RVA process, we've done a number of, and within our processes in general, we've been doing a number of our 5 why, exercises of,
Gotcha.
You ask why 5 times. And every answer, you have to have another why, to get to the root. Because I think a lot of the work around why we're using social determinants of health to measure our equity anyway is really because we're looking at root causes. We want to get to the heart of what is causing this issue to happen so that we can solve it for good, not just alleviate the symptom at the top, right? I think I understand what you're saying.
That's important. Then we put in the risk analysis also. What are the risks? Because with me, with policy, you create policy. It's a breathing, moving document, and through time, it can shift. It can go to the right or the left, or it can go over the beat or under the beat. But you gotta know where it's at. You gotta know where the beat is at, and if you don't, then you're gonna get off beat and you'll throw the whole band off. So you gotta know where it's at all times, because it will shift on you. It can, because of the environment or the culture can make a shift, or new things could be introduced, new elements. You might put a tambourine in there or whatever. New elements might get into that mix, but the why would tell us, and we could always focus back on the why.
Sure. Thank you, Councilman. I just wanted to add, too, that within the structure of the HESJ division and the work that we're doing in terms of I think you can't do equity work without doing policy work. And so hence, the hire of making sure we have on board a policy research analyst in Sarah Tilley, so that for the programs that we work with at the health department, making sure within the HSJ division, especially making sure that that work that we do also automatically comes with a policy and advocacy agenda, right? So when we talk about ending HIV in our lifetime, we have to look at what are the policies in place that can make that happen, right? And how do we advocate for better policies around HIV/AIDS and the root cause of that, to make sure that we're doing the service work and providing services that we need to, but also helping to push the needle by making sure that we're advocating for appropriate policies. So we're doing that for every program and project that we have, and then across the spectrum of HESJ work, that RAFC community work, they're looking at policies and how to advocate for specific policies around each social determinant area that make that work move. Again, 'cause like you said, policy is living and breathing, and we have to think about a lot of things, especially things like maybe unintended consequences of policies that we help enact or that we support, right? And I think that's part of the doing a health and equity assessment across the board on programs and practices that we do, services that we have here at City of Cleveland, to understand, are we putting up barriers in just the ways that we provide services? And how do we mitigate that if we are, and looking at where are the unintended consequences? And when you're providing services, making sure that also at the same time you are advocating appropriately for policies that in helping to inform those who do make policies to understand the effects that policies will have on residents and on the services that we provide as well.
To the director, when you bring us your strategic plan, a lot of times people, they'll do a strategic plan, you'll do the background history, you'll do, you'll narrate to us your goals and objectives, you'll talk about your strategy reviews and all of that. But there's another piece that we have to look at also. I like that the other departments are there, but in that plan, some of the risks or the threats is the outer scope. The outer scope, like University Hospital, they're talking about, and me and the council president will meet with Heidi Garland and her people later. We probably need you to be there. You know what I'm talking about. You see that they're cutting a department out. So.
Oh, I wasn't, to the chair, I'm sorry to interrupt, but you're meeting with them today?
Yeah.
Oh, great.
It's not today.
Oh, okay.
We'll bring you in also, Vice
Yeah,
Chair.
I would love to join, because that, family medicine is a core service for the city of Cleveland. It's the most, if you're going to hire one type of physician or train one type of physician, family medicine is the one to do. So certainly want to help advocate on that front with you. Yeah.
You could do us a favor. I reached out to Heidi Garland office Friday, but she is out of town. She might be back today.
Okay.
If you talk with Laura, you want to be in on that.
Sure.
So we're trying to decide some of the leaders where we're going in, because the risk and the threat when you start cutting, you know, what's going on with your P&L, or what's going on with your, are you looking to downsize? Sometimes trends happen, you know, and you do that in strategic planning also, that you can measure trends and you look at the outer scope of the strategic plan. So we're talking about this, but the outer scope, Cleveland Clinic, Metro Hospital, University Hospital, where they're at. You know, you understand, you see
Yeah,
exactly what I'm saying,
absolutely.
Doc.
Yep.
You can reach out to her. I didn't think about it till I saw you there. I said, man, we didn't include the doctor.
Oh, that's okay. I'll you know, whatever I got, I'll move it around. So
Okay,
yeah, that'd be great. So we'll stay in touch, because I've called university hospitals to let them know my displeasure with that decision, and certainly am involved with the advocacy for them to change their mind. And in the meantime, you know, there are still programs in the city of Cleveland that are training family medicine physicians, and they deserve our support. You know, and we definitely want to elevate them, because family medicine's where it's at.
You're definitely right. So we don't want to see, you see trends happening, and that's how you started to see St. Luke's, and as well as Mount Sinai and other hospitals.
St. Vincent.
The change happened, you know. So we had to get on top of that.
For
And
sure.
so when you do strategic planning, instead of us focusing on, you got to do the outer scope.
I just want to make it clear, too, that the strategic plan that I was referencing is just the strategic plan for that interdepartmental equity team piece. There's
Right.
a whole other strategic plan for all of CDPH and the City of Cleveland strategic plan that's coming out as well.
Oh, I understand. We got you. That's why I asked the doctor to come to the table.
Thank you.
And we were discussing, he knew what I was talking about. So that's very important.
Yeah, and through the chair, we've done our strategic plan for 2023 to 2025. Council was a part of that process, and we presented last year our three-year strategic plan. Councilman Slife came to all the sessions, I think.
He was the vice chair at the time.
Yeah,
We
yeah,
discussed it.
that's
He's
right,
very,
that's right.
extremely bright.
And
You're-
your former policy analyst, Ian Tilley, was there too. So it was-
Yeah. That's important. It's important that, one thing about Councilman Slife in leadership, he can see around corners. And when you're in leadership, you have to be able to see around corners. So he said, I'll be there, Councilman, and that's important. You know, I'm going to get to some questions, and then I'll yield to my colleagues who want to be, of course, I'm sure. Beauty before age, man.
Vice chair before.
Yeah, pick it with you, Harsh. All right. You mentioned hiring, Director. The way I look at hiring, and since it's a scarcity of it, hiring is ongoing. So you have all your job spots filled, but you must also continue to interview for the position. And then you mentioned inventory, you know, that you have interviewed 4, maybe 5 people, but you got this spot. Rebecca is solid, but I don't want, for me, if I'm in management, attrition is always going on, and you lose people. So if Rebecca is gone, then Harsh could fill in, or someone else, because I'm not going to look for that person. I already have, it's in the can for me dealing with hiring. It's an ongoing process. Is that the way you guys are going? Because when you have job spots that need to be filled, it could be issue with that.
Yeah, through the chair, absolutely. We've got a number of positions posted right now, and a big win for us was getting some positions posted continuously. And so that, anytime we hear from residents, council people who want to help us with the recruitment efforts, we've got a job posting that we can share with them.
You can always put it in our newsletters also, or when you visit, like you visit my site, they like you very much. We talked about you when you left, they like you. You're cool beans, man, over there
Thank you.
in Glenville.
Thank you.
bring in some job orders.
Yeah, be great.
Job orders. Say, look, this is what we're looking for. Here's some job orders. You know, work is therapeutic, and they'll like you more.
Yeah.
When you visit harsh neighborhood and you bring in job orders, that's very, very good. But here's the other thing I want to ask you when you mentioned about dealing with the employment side. Training, as you know, training is ongoing.
Sure.
Workers like to be trained. Is there an issue with, like, you got an employee here, but you got a job opening there? Well, because see, I don't know your world. I've never been in management for the city. Do they let you cross-train workers, or do they let you
Through the chair.
cultivate them to in another job spot so you can integrate the workload?
To the chair, absolutely. We have been lucky enough to get a sizable amount of funding from Ohio Department of Health to fund training, as well as that Masters in Public Health program through Case Western, where members of our department can get a free MPH from Case Western, one of the best public health schools in the country.
Very good.
So, plus the Association of Ohio Health Commissioners gives us a $5,000 tuition reimbursement for folks wanting to get a graduate degree. And so so far this year, I think we've got 7 people who have gotten either tuition reimbursement through that program or are enrolled in the free MPH program through Case Western. So there's a lot of cross-training happening, a lot of internal promotions happening with the department, and folks crossing divisions. So it's very exciting.
Yeah,
And that's in our strategic plan as well, workforce development. So thanks for highlighting that.
What about the disability the Commissioner mentioned? I like that as well. You know, I believe in the ability and not the disability. And, you know, with the disability, can you elaborate on that, Commissioner, just a little bit? With disability, you are, you know, we have a Disability Awareness Day coming up on October 25th. And with the Department of Aging.
Yeah. So what I was mentioning then was that I learned through the process of interviewing folks who are working in any type of equity space or with specific populations was that I believe of the Department of Aging Services, there are 4 where it's not just seniors that are getting that service. It is also folks on the disability spectrum. And they don't, when they're accessing those services, they don't have to be a senior if they have the disability. And so I didn't know that they were serving such a robust population that were not seniors in that regard. And so I think that's great. And I know that my partner in some of this work, Director Tyson Mitchell, is also working on a lot of our ADA compliance here at the city and making sure that those things are elevated and in place. But for sure, I think it's, you know, all of our departments, you know, have to make sure that we're up to speed with that, but also thinking about it in terms of the health department and the services that we provide, making sure that we are having equal and equitable access for everyone. But it's something that, you know, kind of goes hand in hand with this work that we have to think about in terms of how we execute and how we create our practices and procedures.
I think I legislated, been around for so long, a committee for people with disabilities back in 05 or 06. You know? I was born. I know, you're young, man. And talk with Mary McInerney. And I know they met with me, and if you don't manage things, it would disappear. And it was under Jane Fumick. Who was?
Nope.
Mike Polensik not here. Was under Jane Fumick, man. You know, and let's get that back going. If it's not there, I'll look for the ordinance to see, and then we'll get that back going, because it's good to talk with the experts and get expert opinions. I'm going to yield in a second. Disability, inequity in healthcare, we talked about that. Hiring and training. I think that's it for me right now. You know what? Let's schedule a trip with some of the council members to drive through or ride through their wards, and where you get an up close view, because council really should do it. We think about, and I might get in trouble for saying this, we talk about a lot of the inequities on the east side, but there's pockets on the west side that, man, they don't talk about it. The other council members, there's shooting over there, and there's a whole lot of inequality there, and healthcare inequalities in all of our wards. You know what I'm talking about, Harsh? And as well as Rebecca. We talk about Glenville Huff at the table, but if you visit Ward 15 and some of the other wards, you'll see a lot of abject poverty in all of their wards. I drive around and see. Then I'm out gigging a lot too with my band, and I visit other people's wards, and my councilman eyes is always on. And I say, wow, they need this over here or that over there also. And it's not just the east side, it's the west side also. I was watching that, did you, Harsh?
Watching what?
The poverty in different wards, and
I
when I
agree
visit
with
you
that.
guys, yeah, I watch it, man, and see what's going on. Because when you're a council member, you're not just a council member for your ward, you're a council member you write laws for people to work, live, and travel through the city of Cleveland. You're for the whole city. And I yield with that to you, Council Lady Rebecca.
Thank you, Chair. Thank you. I really appreciate this overview, and this is such a critical topic for this committee. So thank you, Commissioner. I'm curious about the opiate settlement dollars. How much came to the city of Cleveland through that?
Up to date, it's around 360,000-ish. And so we're looking to utilize some of that to establish peer support. So we have our counselors that run the group programs, and the individual counseling and peer supports do a little bit different work in terms of supporting people in the community. And so it might be, our same program participants who are getting that group counseling and getting individual counseling, but also need a ride to a doctor's appointment, need to access food services, type of thing. And so the peer supports really are much more about helping the folks who are in our addiction recovery services with their sort of everyday, day-to-day needs and stressors. And so we're looking at that, and we're also looking at helping using some of the opioid funds and some of the funds that we just got with Cuyahoga County Board of Health to increase our availability of naloxone across the city, and also provide training for laypersons to understand how to use naloxone, and hoping to partner with the city's rec centers to be able to get some of that education across.
Great. I don't know if everyone at the table or those watching knows, but the multi-jurisdictional litigation that resulted in this settlement was actually based here in Cleveland. It was in Judge Polster's courtroom. And so, it's interesting to see how these dollars are being used in the community. I guess a question that I have is sort of how you see, and I think this is a broader question for the health department, is the provision of services versus sort of being a policy authority. Because I noticed that in the addiction and mental health services advertisements that were in here, I think that's the frontline number, 216-623-6888. So how do your counselors get their clients, and sort of how do you think about your role in this much broader ecosystem that's really, centered around Frontline and the Adams Board?
Sure. So our clients typically come from City of Cleveland Drug Court and the probation program historically, and we're looking to make sure we will always be a resource for those who are mandated through City of Cleveland Drug Court, especially because we're located our services are at J. Glenn Smith, which is our health center, and that particular neighborhood does not have an overabundance of options. And so the other niche that we're hoping to fill, as I mentioned earlier, is being a spot to be able to quickly access an assessment, to be able to get yourself into the type of treatment that you need, and then also working with the vast network of our partners and providers. Sometimes it may look, we're not 100% sure what this will all shake out to be, but it may look like helping to help with folks who are on a waiting list to get into residential treatment. Maybe they need some maintenance counseling in that meantime. It may be helping people navigate waiting lists. And it's also, I think, the major function when we talk about addiction and recovery in the community for the health department and a public health approach. I think a public health job is to come in and fill a need until such time as, there are other resources available that can do that, and then we move to the next sort of public health issue. But when it comes to addiction resources and support, it's also not just about the direct service. It is, but it also has to be about policy and advocacy. It has to be about health promotion. It has to be about helping people navigate systems and get the other issues resolved as well. And so we'll be looking a lot at our presence in the community in terms of providing education and messaging and connecting people to resources. We're not the only ones. We're not the be-all, end-all of providing assistance with SUD, but we have to be able to do direct service as well as that broader public health approach of promotion.
Got it. So I guess it looks like this program is fairly new, right? The new project coordinator and the 2 new counselors, those came on board in 2022?
In that regard, they're new. It's a program that had been around for a long time, servicing people who were coming to us from drug court and from probation. And during the pandemic, we lost our project coordinator and then subsequently lost our counselors, and so we've been rebuilding back up.
Gotcha. So in that, we've had this program for a long time before, and we've been the primary referral for Cleveland's municipal court.
One of.
Okay. Who are the other referrals for Cleveland Municipal?
To my knowledge,
More counseling and Nora.
yeah, so Nora and more counseling.
Yeah. Are your counselors able to handle the volume that's referred to them by Cleveland Municipal Court?
They will be. I think when the court recommends, a client to any one of those resources, whether Nora or us or whoever, they look at, and we're able to look at the counselor to client ratio and make sure that we're only taking on what we can handle. And so with 2 full-time counselors, we'll be able to conduct our group counseling as well as our individual and still have clinical oversight. And then with the peer supports coming on board, that's just an extra added way to expand our capacity.
Got it. And so the opiate settlement dollars, are those being used to cover the staff costs for the program? Or
Some.
Okay. How else are they being used?
So we are making sure that it's going to help support, along with those a little bit of county dollars to support the naloxone efforts. And then we've reserved some that we're actually looking at a couple of different initiatives that would be more us providing some funding in the community for other supports. Dr. Margolis, do you want to talk about that a little bit?
Yeah, to the chair. So we just, the money is new for us, so it's still, developing the plan, but lots of need out in the community. Just to put it in perspective, the county, through those opioid settlement funds, got, I think, $120 million.
Yeah.
And the city,
Yeah.
as you heard,
Yeah.
is getting $300,000.
Yeah.
So it's, we're definitely a small piece here, but it's every year for 18 years that money. So,
Okay.
and there's more money potentially on the way. So we're excited to show up in this space in a big way that we haven't historically.
Yeah, I look forward to hearing more about this and kind of, I think that question I know is very top of mind for you, Director. I'm sure top of mind for you, Commissioner, this idea of where are we providing the direct services versus
Yep.
where are we sort of like the policy leaders and like what are we best at? And it's fascinating to me that, we have this history as being one of these referral sources. And I would guess, as with any sort of referral or social services network, that there are programs that are particularly good at a particular type of client, and people who are good from the court, people who know the system, they're like, oh yeah, that's a great person to send over to the city of Cleveland because they're going to know how to handle this person, or that's a great person for Nora, or that's a great person for whomever. So I would love to understand, even if it's offline, like what kind of our niche is and what we add on to the capacity of, obviously a system that has a lot of need and has a lot of stressors in it. So kind of understanding our philosophy around where we play that role is really an interesting question to me.
Agreed.
I believe that with that, I will yield and hand it over to Councilman Harsh.
Thank you, Chairwoman. You've saved me a lot of time because those were some of the questions I had as well. But to follow up on that through the chair, was the county's money also annually for 18 years?
Through the chair, there is some amount of money that the county has that they'll be getting annually. I think it's like $1 or $2 million, but it's still.
It was a upfront payment to the county
Yeah,
for the
I
most
think
part.
they were like a bellwether county, I think
Okay.
was the term. And so they've spent that on the diversion center, the majority of it.
Okay. Through the chair, my question is on page 4. If you want to backtrack, I just want to make sure I understand the department correctly. You said you had 14 full-time employees, but I'm counting 12. I've got 3 in Omar, 4 in Moms First, 1 in HIV, and then yourself, Mr. Ali, Ms. Hill, and Ms. Tilley. And so I'm wondering where the other 2 are, just for
I think
placement.
It's 14 positions, right?
Did you say
Wait.
Moms First? Yeah.
It might be
Yeah,
easier
I've
to
got
count
4
here.
in Moms First, 3 in Omar, 1 in HIV.
There's
That's
actually
8, and then
6.
4 more.
6 Moms First.
But those are vacant.
2 are vacant.
Yeah, we're including vacancies.
So there's 4 up there.
Right, we're including the 14 is the.
The 14 includes vacancies.
Yes.
So there should be 10 people full-time. And that's still 12.
Well, it's
Wait. No. If we're,
let's see, no, maybe it doesn't include vacancies. Let's see, 14.
yeah, it's 16, including vacancies.
Okay, so the previous page should be 14 full-time employees?
Well, to the
I mean,
chair,
12, it should be 12.
It's also fluctuating. So we have,
Yeah.
I think, 2 job offers out right now, and one of our
And 2 postings.
resignations left like last Friday. It's right, 2 more postings. So it's not. So I think it's easier for us to use the
The
number
chart,
of positions that we're rooting for.
Okay, so there are 12 people in the department today. The 12 that are up here.
Yes. Yes.
There are 12 current full-time. There are 4 openings.
Yes.
For a total of 16 positions.
Yes.
Okay, so the previous page is inaccurate.
It needs to be updated.
Okay. I just want to make sure I understand what's going on. And, unfortunately, the reason I asked is that we're going to hear this a lot over the next month. A lot of things are up in the air, but we might be cutting 2% of the budget, and we have to figure out where that comes from. And so I'm just trying to understand what's filled and what's not filled. And that's why I'm glad that the chairwoman asked about the grant funds and how much that is. It's good to know that that's reoccurring, so we don't have to worry about losing that, right? So my question through the chair is, what percentage of your budget is staff and what percentage is materials and goods and non-personnel related costs?
To the chair.
I know,
yeah,
but it's going to
I
come
don't
up,
know
and we
if
should be
I'll-
prepared
No,
for this
that's a
because
good
this
percentage
is on the
question.
table for November.
I'll
We
go
don't
with
know.
I'll use the overall, I assume we're the same as the
Yeah.
75% or 80% that the rest of
75
the
to 80.
cities with, I mean, most of our money goes to
Nothing.
staffing, and then the rest goes to paper clips and printer ink. and-
Okay. Could you cut 2% paper clips and say 2% of departmental budget on paper clips?
It's a lot of paper records. We're working on that.
It's an unfortunate reality that we might be confronted with. So, I'm going to ask this question a lot in the next month as we have operational. I understand this isn't an operational hearing, but following up on the chairwoman's questions as well, I see a certain percentage of your work is externally focused on people in the community, and a certain percentage is internally focused on processes, procedures. What do you think the split is there? Like, how much of your time in the department do you think is spent focusing internally on racial equity and those issues within the city, as opposed to the work spent with people in the community with, you know, Moms First and
Yeah.
the addiction and all that?
I think the bulk of the work is with the programs that are within the health department that are in the HESJ division, so Moms First, Office of Mental Health and Addiction Recovery and HIV services, and now Minority Health. That's probably the bulk of the day-to-day. The work of the RAFC, that is a coalition, and it's a
Right.
public-private partnership, and so I help and assist with that, but that's really driven by
Right.
the external folks who are on that, Marsha
Okay.
Maccabee and Helen Forbes Fields driving that committee or coalition. And then the internal work around our policies, practices, procedures, looking at equity across City of Cleveland probably comes in second to the programs. And I would say overall the split is probably 50 to 60% those programs that are dealing with health disparities, and then maybe 40, and I could be lopsided
Sure.
on this, maybe 40 combining the IET and the RAFC work
Okay.
for right now, because I think the approach that I'm taking and the work that has to be done up front is taking programs that already existed at the health department for decades, and so really going one by one and updating them and bringing them into 2023, 2024 is a huge process. The vacancies that we've dealt with in the past and the sort of staff transitions, I think that has taken to get make sure that the programs are providing optimal services and making sure that they're operating in today's world versus, you know, a couple of decades behind, going through records retention processes and things like that. And also that is the day-to-day people work within the health department that I do. I'd say that since this division is so brand new and we're bringing 4 programs together that have never worked together before, that has taken probably the biggest concentration of time so far. But I have a feeling that as we move forward with the IET and having that strategic plan done and beginning to do health and equity assessments and now getting that equity advisory board off the ground, that will shift a little bit to be able to be concentrating on that some more.
Okay. My last question then, and thank you for that detailed answer. My last question is about the Moms First numbers. They seem down quite noticeably, while the number of visits has gone up quite noticeably. So it seems like people are getting more intensive care, but there are more intensive service, but there's fewer of them. Is there any particular reason why those numbers are down so much?
Yes. So again, all of our numbers are kind of topsy-turvy, lopsided coming out of COVID, but I think the biggest thing for us in 2023 is that we had to readjust the staff to make sure that we were giving equitable and living wages to the folks on the ground who are doing community health work, and so that kind of shrunk the staff a little bit. But in terms of, we had a broader number of positions with multiple vacancies because the hourly wage was lower compared to other community health workers. And so what we did was compress that staff a bit so that we could offer competitive living wages. And so that it's going to take a little bit of time, but we finally, with that change happening over last spring and summer, we are, with our external agencies, I believe everyone is fully staffed at the moment, except for one agency has a vacancy, and this is the first time all year that they've been properly, fully staffed. And so as they're, you know, some of them are coming out of training and seeing clients now, some of them have a couple community health workers that are still in training, but I do expect to see our numbers get a little bit more back to normal.
Okay.
Yeah.
Through the chair, was there a birth spike from COVID? 21 and 22
No,
are
they
like in
said
100. I mean,
no.
people
They-
were
I
home.
think,
But there was
through the
no
chair,
burst.
I think they expected.
It seems like if the numbers went up and then come down, like
It's
there could have
kind
been.
of it's kind of a real thing through the chair. They there was nationally predicted to be a pandemic like baby boom,
Yeah.
and it didn't.
Oh, it didn't. Okay. A little too nervous.
really.
All right. Okay. Well, that's all. Thank you very much. I appreciate you. Thank you, Chair.
Yeah, absolutely. Anyone else?
we had a baby, so.
You're doing your part.
Yeah, we've got to increase the city's population. Just two comments. One is kind of a note of appreciation. I really enjoyed the inequality, equality, equity, justice graphic. I will admit that sometimes I struggle not with the concept of what we're trying to do with equity, but sometimes it seems to be almost stated as like the problem and the solution. And it always, I couldn't put to words why I kind of struggled with that. So knowing that there's the step beyond equity of justice, I think helped kind of solidify that for me to know that we're trying to fix the system to offer equal access, to tools and, as it says, tools and opportunities, but that's the permanent solution. That's what we're working towards. So I think that was a good framing. I'd be interested in, and we can speak offline about this, but kind of thinking through like identifying an inequality, what would be the equality reaction, what would be the equity reaction, and what would be the justice, and is there opportunities to go straight to justice, or do you have to kind of proceed through a process in certain situations to build towards it? That's something to kind of mull over. The other is sort of in reaction to something you said, Commissioner Wills, about making sure that we're not putting up barriers in the way we provide services. I think another way that I would spin that is making sure that we're not exacerbating barriers in how we're aggregating our data. Because as Councilman Conwell mentioned, there are, too often I worry that we're stuck in this kind of dichotomy of East Side, West Side, and East Side is, overwhelmingly black and West Side is overwhelmingly white. Therefore, if we're trying to work on the racial health disparities, it causes us to concentrate only on one part of town and not another. And I guess I would be interested in how you take like a neighborhood on the west side that is, I think like Ward 11 is like 50% white, and that kind of increases from there, and understanding what the intra-ward inequities are, and really saying like, yes, the number of children being born premature within this population is X, but if you narrow it down into subpopulations, do you still see those inequities, and do we need to make sure that we are creating support systems and infrastructure and connections in places where they might not be as historically as strong and robust, just because there's been a movement of people, as people from the west side have moved east, people from the east side have moved west, and we need to kind of accommodate the year 2023 and not think that it's 1980 or before. So that's I don't know how easy it is to aggregate the data down to that kind of granular level, like census tract and other things, and even what the if it's even accurate at that point. Is it a large enough sample size? But I know that I worry often, and I've said this many times, that there's a very large public housing property in Ward 17, and when we have a tendency in the city to aggregate things in 17ths, I worry that large population sort of gets lost in the data, and trying to make sure that I'm advocating that there's resources for people who I think and suspect need them, and align with all the goals that we're working towards. So that's just a kind of a comment of if there's a way that we can make sure that we're not falling into our own data trap and leaving people out unintentionally. So.
Sure. Through the chair, it's really interesting, but also in terms of the work that we're doing in health equity and social justice, and probably the rest of the health department, we rely obviously very heavily on data and how we analyze it, and we've been on the equity work side of this work, meeting really closely with our epidemiology team, understanding the data across the board, but also being able to, like you said, get granular and understand where we see that's what I love about public health, is that we are able to suss out and find where we see patterns and trends this big, right? Looking at the scope of things. And so I think in that way, it's public health's job to do exactly what you're saying, is find those pockets where we have the same types of outcomes, right? And so we do utilize census tracts quite a bit to make sure that we have our data is informed, but also to make sure that we're looking at things from all of our demographic levels, and how you could get, down to almost the street, and find an issue there. And we use that same type of data, a process when we thought we're, thinking out our vaccine rollout plans and things like that. And so for us, in the four, sort of major health disparity issues that we work in, of course, we're looking across City of Cleveland as a whole. But I think when you talk about health equity and social justice, you have to consider your geographic, data points and where your trends are geographically as well as demographically. And so you're looking at people and place, right? At the same time, it has to be sort of two trains running so that you hit all of the trends. Are you making fun of me? Okay.
That's great. Then I'll turn it over. I don't.
Yeah.
I think we're singing the same song.
Yeah.
I do worry sometimes that it's easy, whether not just public health, any department, kind of the law. What happens when you just look at the law of averages in 17 cent that loses the intra-ward nuances and diversity that we see and that we're working to contend with. So with that.
You, Commissioner, and I like it, I like the way you're thinking. You mentioned processes a lot, so I walk away thinking about that. We were discussing in a friendly argument. You ever studied, is it still around Six Sigma?
Lean Six Sigma?
Yeah.
I have not. I know about it, but I've not taken that certification or training.
Yes, they talk about like in the fishbone process analysis. This, you'll see you have a fishbone, and then in those fish bones, those different parts of the bone are the process analysis for good customer services. And you ever had it, Doc? The Six Sigma?
To the chair, yes, I have a green belt.
Yes, you know it. The green belt is hard. It's hard. Star know about it. You know what I'm talking about, don't you, Star? Baldwin Wallace have great. Did you study at Baldwin Wallace?
No, to the chair, no, I studied.
He's a Baldwin Wallace graduate.
Yeah, Baldwin Wallace is wonderful. We work closely with them. I studied at UCSF, San Francisco.
Okay, yeah, it's good school. Yeah, it's good place to study it. Yeah. You ever thought about the commissioners talking about processes? Six Sigma hard. It's pretty hard, but it's good. What you think?
To the chair, she is far surpassed. If she took the test, she'd have higher than a green belt.
Yeah, you have high. You'll be a black belt. You know what I'm talking about. She looked at it. Councilman Starr was just narrating to me about you doing scorecards, and what was the other one you narrated? You were talking about, Councilmember Starr. What was the other one you were narrating?
No, I was just asking about, offline what I was asking you is, through the chair, what about a SWOT analysis overall, understanding what we're doing, from strength, weakness, opportunity, and threats?
For sure.
How do we have that planned, and how do we follow through to that to understand? And then also the strategic goal that comes from that assessment or that analysis. So.
Sure, I think through the chair, I think that using a SWOT analysis is, a huge part of almost every strategic plan, and so I do expect there to be some version of that. In terms of getting to our strategic plan, we use results-based analysis, which is where you get the turn the curve plans and scorecards. So that's what we'll be employing for the interdepartmental equity team, and that is what is coming online from the Racism as a Public Health Crisis Coalition, but definitely to make sure that we're measuring all of this. And the SWOT analysis features heavily in the department's strategic plan as well.
Star. I'm gonna say this real quick. I know I'm talking a lot because I get excited about measurements and those kind of things. Because that's how I know where I'm going. Sit back and read it. Even when you're campaigning, you don't just go out and campaign. You put together a plan, and you measure the plan to see where you're at. So you got to do those things. And when you give us the during the mayor's transmittal, is it possible you could put the strategic plan in with the budget?
To the chair, yes. Yeah, we did last year, so you have it, but we'll resend it, and make sure that you have it for,
But I mean, like.
October
when you
23rd
give us
and
the
as well.
budget book, so we can correlate it with the budget, because it can't correlate, because you only have four things we're measuring in the budget. There's only four. You got people, which is cost of labor. You have equipment. This in there, we talk about equipment. We talk about supplies and money. It's only four parts.
Sure.
Equipment, supplies, money, and people, cost of labor, being that sick time and all those kind of things
Yeah.
that's in there. So, but you could do a strategic plan that correlates with it.
sure. Yes,
right.
absolutely. To the chair, yes.
I want to yield to Council Lady Stephanie House. Jones, we need to put the Jones on there?
Yes, I know they do. I've asked, I've requested it.
Okay, all right, cool. And congratulations
Right.
again.
Thank you.
Stephanie House Jones.
Thank you. It's going to be a process for all of us. Thank you so much, Chairman, to the Commissioner and Director. Good morning. Thank you all so much for your consistent, just continuous work. And Commissioner in particular, I know, just how hard, you and your team have been working as this takes a while. This is going to take a while. So one of the things as we've been having the conversation specifically on processes, and I'm looking at the whole thing around mapping connections in particular, and I was looking at people that were involved and then how it's kind of broken into it. And while I see the law department has a representative, I don't see the law department actually being a part of mapping connections. And in particular, the law department is not designed and operates through a lens of equity. And this is my statement as Councilwoman Stephanie House Jones. They are not. And I really feel like we are going to have to really get to a place where the law department is looking through a place of equity. One of the things I am going to at least raise up, and I want to bring a clear example of how equity is not looked at, and how we, I think, in Cleveland City Council and working with the administration can rise up equity, right? Specifically in the moral claims form. If people are not familiar with the moral claims form, this is a process where if something happens, I'll give examples because these are real examples of Ward 7 residents. And it's dealt with trees, where a tree have fallen on people's houses. It has fallen on people's cars. And the way our current system is designed is that after someone gets a claim through their insurance company, then the resident will be able to fill out the moral claims form, and then the city, if they do the research and if we are held liable, we will reimburse the insurance company. So in several cases, 4 to date, I have residents who did not have insurance. So there was no one to get anything back. And to this day, they are still scrambling. No car, damaged property that was a result, likely, allegedly, of a City of Cleveland tree, and they're just out of luck. I've brought it up, but I'm looking at these mapping connections. The law department must be in here when we're talking about equity. It's not equitable. If we are talking about specifically, economic stability and neighborhood and built environment, that's what it is.
Sure.
And I know it's difficult, and I know our system is designed to be protection of the institution. We also have to operate with a real sense of understanding who we truly serve. When someone has a household income of $21,000, you are robbing people to pay Paul. Or anyway, you trying to find how you going to feed, or, 2 birds with 1 seed. You're always doing that. And so I'm looking at this stuff. I know we're going to have a strategic plan, and it is a glaring, amiss to not have the law department listed specifically as a department in economic stability and neighborhood and built environment, and really trying to challenge, because again, I understand people have just, the law process and how it's designed, it's based on Constitution and based on however the process is. I'm not a lawyer, I'm an engineer by training, so my thought process is thinking on how we truly solve problems. And I am really going to challenge us as a city to really think through, how do we fix this? This is a problem, it is hurting our people, and we can do better. We must do better, because it's not right. And then you try to go and because when people want to talk about oh, well, council could just use the casino dollars or you use block grant dollars. Again, still been trying to figure those things out, but even in those processes, it always requires you to find somebody who has the dollars and then get it. But a lot of people don't have that upfront cash. $20,000 and $30,000, and I always talk about the over-reliance that we have on many of our community development corporations. It is not equitable. We have these conversations, me and Councilman Starr and Councilman Hairston, we've been talking about casino dollars. It is not equitable. When people have been talking about, they want to support the Little League to require them to pay $5,000 or $10,000 for the uniforms. It is not based in equity when people don't have the dollars, but they're doing good work. We don't have the capacity to do it. And so it is absolutely vital for the law department to be explicitly listed and for them to come up with a process where they can begin to evaluate themselves and their processes to lift up, even internally, right? Because you got confidential culture, so y'all can really think about and talk through those things. And then from there, so that was a whole soliloquy and conversation to get to my question. Will the law department be included in one of these things, or what has been the process? Because I know they're participating, but the law department has not been explicitly listed as a mapping connection when it comes to equity.
Thank you. Through the chair, just for a quick reference on those two process maps, that's just an example, and that was not an exhaustive list.
Okay. Okay.
That was like a result of one of the brainstorming sessions that we did in each group, neighborhood and built environment, economic stability, health and healthcare, and so on and so forth, did brainstorming, and we keep coming back to that because we're like, oh, we forgot this, and I'm not saying we like us, I'm saying we, that whole interdepartmental equity team where we have multiple people on board. And I can totally appreciate what you're speaking to in terms of the processes that are in place, or that may be creating barriers, or Councilman Slife had another way to say it earlier, how we do business or how we operate every day that could be impacting negatively, right? And so I think the process that we're working on that is ultimately designed to make sure that we're looking at everything that we do with regard to providing a health and equity assessment to a specific procedure, right? That's what we're planning to do. That's going to be a slow process. However, what you're talking about is an acute situation that's happening right now, right? And we have a lot of them, right? And so because of this process that we're working on to bring equity to, a tool to be able to find equity gaps and find how to fix those. I mean, ultimately, how many of those can we do in a year, even if I'm talking 3 per subject area? Still maybe 12, 15 in a year. However, I think you have this acute situation that you're talking about that's going to require an acute solution, right? So I feel like there are things that, yes, we'll get to things like that when it comes to putting this strategic process in place, but there are things that have to be handled now, right? And so we might be having to look at, and I don't mean just me or the health department, I mean across how we do things, short-term solutions while we build a longer-term solution, right? And so I totally can appreciate that specific example. And I think we've heard, by bringing that interdepartmental equity team folk together, we've heard a lot of their immediate problems, this is happening in my department or this particular program, these residents are being left out, and there is that sense of like, what can we do right now to help fix that specific issue while we work on this longer term solution that hopefully gets us there. So I think there's going to be a lot of that happening. I think some of that too in the conversations that I've had with folks that we're trying to pull together for that separate from the interdepartmental equity team, just looking at DE&I work across City of Cleveland for employees and as an organization and in how we serve residents, bringing people together on that equity advisory board. I'm hearing from them already. We haven't even had meeting one yet. This is a solution that I want to put in place, but we've not been able to do it. Or this is something we should have done years ago and we could fix it like this. So we're going to bring all those people in a room, and that's because when you hear people, like in this minute you open the meeting, you open a conversation with them, they're like, let me tell you about this problem and I know how to solve it and can we do this, right? Then let's get together. Like I was telling you all earlier, there are going to be solutions that we can enact at very little cost. It might be just flipping how we do something, right? That we could fix in 3 months' time. Let's get all of those on the board. What are the things that we could fix in 6 months? Let's get all of those on the board. What are some more long-term solutions that they, in their working world, are running into in terms of how we're servicing folks, residents in particular, how we're, our processes for employees, how we're working, together. Let's get those low-hanging fruit on the board and start to make those recommendations, right? But I think there's always going to have to be room for and the ability for every department, including law, to learn how to pivot and to be able to enact a change or enact a solution for right now while we're still trying to look long range at how to do this on a more permanent more permanent basis.
Yeah.
But thank you for that. I completely understand that.
Yeah, thank you through the chair to the commissioner. Thank you so much for just lifting that up. And again, I just thought in this moment,
Yes,
we
yes.
really have to talk about this. And I want people to understand this is not a knock on the law department. Please understand, it really isn't. It's just, I have seen it. And I don't actually think these are one-offs. I think this actually happens way more frequently. But people really, in the terms of trauma, you just figure it out and you push through. Right? You figure it out. Oh.
Council Lady, we could bring in the law department probably to the finance committee, because you're right. The residents aren't being treated fairly. And with these moral claims, they don't know about it. They're always being rejected for morals claims. The residents get mad with you and I. But we just bring them in.
Yeah.
Have a discussion, a conversation with them.
Yeah, and I think it's really getting to a place of how do we move forward, right? Even like I said, I'm going to lift up the casino dollars. Myself, Councilman Starr, and Councilman Hairston, we are exhausted. We are exhausted of having the continual runaround of. We're just trying to get people like literally. It's like, what are we here to do? You know what I'm saying? And it's just like, I truly, when you center people, the overwhelming majority of people are good. They are doing the right thing. Design stuff for the people who are doing good, who are invested in our city, not for the people that's going to do bad. Because when people do bad, they get caught and we punish them accordingly. But don't treat everybody that way. And that's the reason a lot of times what we lift up, we treat everybody like they're going to steal the money. They're not going to do right. That's not the case for the overwhelming majority of Clevelanders. They are good. They are so charitable. And if we can invest a little bit into them and remove those barriers, our city will really thrive. That's what I'm saying, the mindset. When your mind can manifest so many things. You can manifest the good things, but you also can manifest the bad things. So I really want us in this equity conversation to manifest the good things and find ways to partner with our people in real ways based on what the census data tells us. If you're in a community with $21,000 average household income, you got to think differently. When someone, a community is average household income is $12,000, what is equitable about that? How do you invest in that community? But we have a one size fit all for everybody. Everybody is a middle income family and everybody got the money to upfront it. No, they don't. And I really, really want us to get to a place that we don't just think about it, we just don't talk about it, but we're actually putting real practices in place that can lighten the load for our people because they deserve it.
I like that. That's true. You know, Doctor, we could put in, I'm growing your strategic plan. You could do an individual service plan because it's not one size fit all. This family have different issues than the next family or the next family. You had an individual service plan in there, and that way you could, in your case studies, then you're able to see which direction they're going in. Because if you do one size fit all, it's just not going to work. Even when I talk with my residents, I'll sit back and get frustrated because when you guys don't execute, they don't know, Director, they don't know you, Director, but they do know Rebecca, the council lady here, or Councilmember Chris Harsh, they know us. And so we, or Councilwoman Jones, make sure I get everything right. I don't want to get beat up later on. But you're right. They beat us up. They beat us up. When you don't execute, like I see the plan is beautiful. I like what you mentioned. You can do overlapping projects. That's what you were really narrating. If there's an issue here and you're planning to move ahead, you can work on this issue at the same time. You could do chew bubble gum and walk at the same time. However, you got to execute on it. You have to execute on it. And like even in my ward, you have to look at, and the health issues is there. You want us to push on another piece of legislation, but there's other health issues that's there. You got to visit the stores. You have to go in there and focus on these other health issues that's there. And the main thing, you have to return residents' phone calls when they call you, because if they don't, then it's going to be us receiving the 62, 63 phone calls a day. You know, right, council members? And they blame us for it. They blame us for it. It looks good, but it's art, because they don't know, you know what I'm saying? They don't know you guys, and we get the blame. So you could push it, but you got to execute on it. As we say in jazz, you got to walk it like you talk it, or you lose that beat. You know, so you got to do that. That's important. Any other questions? You presented well. Bring it back to us later, but later I'm going to give you a date because I don't like saying as soon as possible or later. I like putting a date on it, but we'll talk about it. Director, I talked with Levita and had her to add your name on to with University Hospital as well. That's when I got up, I made that move.
Thank you, I appreciate that.
To my colleagues, we're going to meet, and I was looking back here, on Thursday at 9:30 a.m., Chris Harsh will love it, at the Music School Settlement. And that's, not you guys, but you're welcome to come to it, Director, Music School Settlement. That's on
It's my alma mater.
Music School Settlement? Oh man, you can come through, it's cool beans. We, the new arts and culture senior strategist on arts and culture, Rhonda Brown, will be giving us some background history about herself and her strategic plan, as well as her vision, the way we're moving the city forward in the arts. We're looking, you know, as you know, we had a groundbreaking last week, I think it was Thursday, for the Rock and Roll Hall of Fame, and we're looking to spend $150 million there with the arts. They did a capital campaign for it, Greg Harris. And as Chris knows also, as well as Stephanie House Jones, her family, Bone Thugs and Harmony. And so a lot of the arts and a lot of the music came from Cleveland. But it left Cleveland and it went to places like Austin, Texas, and Nashville, Tennessee, Memphis, and places like that. We have to make Cleveland more economic, dealing with the arts and the music to build it up. So she's going to be there narrating, Rhonda Brown, the chief strategist, her goals and objectives for getting Cleveland back on board with the arts. We'll talk about the schools and how the arts was killed in the schools. When you put instruments in children's hands also, but like we're doing Play It Forward Cleveland, last year, or it might even been a year before that, we people donated to Play It Forward Cleveland $100,000 worth of instruments, drums, flutes, guitars. This council, we spent $250,000 having free art classes for the children in the city of Cleveland. We gave dollars to Julio de Burgos, Cleveland Music School Settlement, Rainey Institute of Music, and Arts-Inspired Learning. And then with the instruments that was donated, people like yourself, doctor, who became a doctor, stopped playing their violin, but they brought their violins and they gave it to the children. And the children were smiling and happy, and they're at home practicing. And then we know this about the arts. It also builds good character. The good character of self-discipline, because you have to practice, good character of organizational skills, and they become good leaders, doctors, dentists, lawyers, scientists, whatever, and they're home practicing on their instruments. So you'll see children there, they'll give us some performance, council lady, and they're home practicing. Because everyone doesn't play football, and every community can't be like the home of the mighty, mighty Top Letters, Glenville's state championships.
Everybody can lose the world. That's true.
Everybody can't be like that, man. Like the home of the mighty, mighty Top Letters. Oh, I'm talking, I had a mic, yo, man. The mighty, home of the mighty, 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 mighty Top Letters in football. But music is correlated to sports also, because it builds the arts, and you can do project stuff there. So we're very, very happy, and we have to push the arts and find things for children to do, and do away with these idle hands. And doctor, I'll say this in my conclusion: children need to see success every single day. That's very, very important. So this Thursday at the Music School Settlement, we're there. We won't be there long. And anybody from the listening audience can attend. Thank you, and thank you very, very much. And you can ask about the programs. We're also giving away drum sets and all of those kind of things for children, so that's cool beans. Hey, drum's cool, man. At least you know where they're at. Yeah, you want the drum set, man. At least, yeah. Yeah, big old bass. It's better to hear kids down there playing the drums, doctor, than being out in the streets, you know what I'm saying? So at least you know where they're at. With that, no more questions. Conclusion, thank you very, very much, and God bless.